Find out what's new in TMJ and sleep apnea, or the dysfunction of the jaw joint, now known to cause headaches, migraine, neck pain, back pain, as well as a variety of other issues, and sleep apnea, or the stopping of breathing while you sleep, now related to high blood pressure, heart disease, and all too often, an untimely and all too soon death. We're in the offices of Dr. Leonard Feld. First of all, Doc, thank you again for allowing us to bring our camera and crew out and for spending the time to educate us what's new in sleep apnea and TMJ. I asked you to have a few patients out. See, we had quite a few show up, so we're going to interview them and talk to them a little bit. But let's just get started with talking about the latest advancements in sleep. Now, if I told you before, I would never have thought to go to a dentist for sleep issues, for snoring or you know, any kind of conditions to deal with sleep. Tell me a little bit about it, what it is that you do for sleep.
Well, we first try and diagnose the patient. We do testing. We monitor the patient, and we do what's called a polysomnogram, sometimes in the hospital and sometimes a study is done at home. Or
now you have mobile sleep studies that you actually send people home with from here, for those
Yes.
that don't want to go
to the hospital.
Right.
Well, we found that most of the people, 90% of the people that have problems breathing are not diagnosed because they don't think it's a problem, or they don't even know it's a problem. And so when we're fortunate because most patients see their dentist more than they do their physician. And so a dentist has a chance to take a look at the signs in the mouth for these particular issues, because they can come out in the mouth by virtue of how the body reacts to it.
So are you telling me that 90% of the people with sleep issues don't know, either don't get diagnosed or don't know they have them?
Right.
So what would be some signs? I mean, obviously, and I asked you about this before, obviously if I have a big bruise in the middle of my back from somebody hitting me with an elbow because I snore all night, might be a symptom. But is there other things? Are there fatigue, tired? I mean, does it affect kids? What is it that you would be looking for?
It can start at a very young age. Grinding of the teeth is a real good one with children, and they start gnashing their teeth at night. It's usually an issue of breathing.
Well, I've had friends that say they grind their teeth and they get an appliance to stop them from grinding their teeth, but they never mentioned they had any problems with breathing. They just said their dentist gave them an appliance to protect their teeth.
Well, in dental school, for years, they've taught to put an appliance to protect the teeth, because dentists protect teeth or work on teeth, and that's what dentists do. So they make these things to protect the teeth. But the question is, why are the patients grinding? Why are they grinding instead of let's protect the teeth? And it's usually an issue of an interference, a malocclusion, a bite problem, a jaw joint problem, a positioning problem, causes this trying to get the bump out of the road, you know, trying to make it smooth. Or a position where someone has some pain subconsciously in a level that they don't know they have pain, and they just, oh, that feels better. So they push on the teeth, but they don't know they're doing that. And it's usually at night when they're relaxed, when the systems of the brain work differently than the ones during the daytime. We have basically two different systems. The systems are the parasympathetic and the sympathetic. And the parasympathetic, it's a big word, but that's the part of the brain that works at night to try and keep you alive. And when there's a function or an interference with a function of the body, then usually what happens is the part of the brain which is called the sympathetic system takes over and starts working at nighttime to try and keep a person alive. And that's where the fatigue sets in, irritable bowel syndrome, autoimmune disorders we've found, and of course, if a person wakes up with a headache, then they've been working all night.
Clenching their teeth.
Clenching their teeth.
So if you clench your teeth, it's probably a good sign something's wrong?
It's not normal.